Hey, Dr. Alexander here at Alexander Chiropractic. Today I want to talk about the Denneroll. And so if you're watching this video, I may have recommended you to use one at home. If you just stumbled upon this video, pay attention. If you have any neck pain, this could be something that could really help. So the Denneroll, not dinner roll, is actually a product sold by idealspine.com from the Chiropractic Biophysics Association. They're the premier leaders in chiropractic on fixing abnormal curvatures in the spine. So one of the things they found is that to change a spinal curve, you have to do three things. You have to affect the joint, which is done through the chiropractic adjustment. You have to affect the muscle, which is done through exercise, and then you have to affect the ligament, and that's done through something called traction. Fortunately, there is a way that you can do traction at home that is very effective and proven in the research to help restore normal curvatures to the spine. So one of the ones that we see very commonly is the Denneroll for the neck. It's a hard foam block. It's a medical orthotic. These cost $60, and I highly recommend using them if you have lost the normal shape to the neck. So I want to come over here and show you what an abnormal curvature should look like. So actually first let's go up here, and you can see this is what a normal neck looks like. The head is sitting right above the shoulders, and you see this nice C-shaped curvature to the neck. And that's how the neck should look from the side. You can see how the Denneroll, this person is laying on it, and it's really reinforcing that natural curvature to the neck. Now what we're seeing a lot of times now is necks that look more like this, where they really have a straight shape to them and they don't have that natural curve. What that does is it can cause abnormal loading on the joints and an abnormal stretch on the spinal cord. Normally the spinal cord sits right behind the spine here, and when the normal shape of the neck goes this way, that spinal cord gets pulled tight, and it actually restricts blood flow to the spinal cord and can cause a lot of problems. We see headaches, neck pain, shoulder pain, fatigue, depression of the immune system, and a whole host of other problems. Since we know the nervous system controls everything in the body, we really want to keep it healthy by keeping that spine in proper alignment. The other thing that can happen is we can see degeneration in these joints start to occur as time goes on. So a normal joint should look like this, but as time goes on, it can start to look like this, and even like this if we leave it and don't fix it. So what we do is we recommend chiropractic treatment in conjunction with using the Denneroll at home. So there are different sizes of Denneroll. There are three sizes. There's a small, which would be for pediatric kids mostly. For teenagers and adults, most are going to use a medium. If you're around 5'11" or taller, then you'll probably go with a large. But most people are going to use a medium. This is a medium one right here. And what you can see is there's a part right here that says shoulders this side. Your shoulders go on that side. So I'm going to demonstrate what that looks like when we use this at home. So if you were to lay on the ground, you don't want to do this on the bed. You do want to lay on the hard ground. That way it doesn't sink into the bed. And then you want to lie on the Denneroll with the bump right here hitting the part of your neck where you're losing most of the curve. So for most folks, that's going to be right in the middle of their neck. So that's going to hit right like that. There we go. Now you can see that my chin is up and it's not tucked in towards my chest. If it goes up too high, what you'll see is that it's tucking my chin into my chest. That's the wrong way to do that. That's actually going to make the problem worse in most cases. So you really want to have that down so that the neck is fulcrumed open like that. Now you're going to start out laying on the Denneroll for 3 minutes your first time. The next day you're going to do 4 minutes, the next day 5 minutes, and so on until you hit between 15 to 20 minutes. And that's the ideal amount of time to do the Denneroll in a day. So once you get over the 10-minute mark, that's really where the Denneroll has the biggest effect. Below the 10 minutes, you're really not making long-term changes to the neck. So your ligaments there's a phenomenon called creep. And creep is when your ligaments make a permanent change. So typically a ligament, if you were to stretch it, it'll rebound right back immediately. That's called the elastic phase. And from the first minute to the 10th minute, you're really in that elastic phase where it's going to kind of go back there. Once you get over the 10-minute mark, between 10 and 20 minutes, you're in the plastic phase. So if you were to stretch a piece of plastic, that would permanently change afterwards. After 20 minutes, you're really not doing a whole lot, so you might as well not do it. It can actually make things worse if you do it for longer. So that's really what we want to try to achieve with the Denneroll. Typically, patients will use this anywhere from 3 to 6 months, sometimes longer. Now, one of the crucial things you need to know and you need to learn from your doctor before you can use one of these is where the abnormal curvature in your neck is, because this can be either placed in the lower neck, the middle neck, or the upper neck, depending on where your loss of curvature. On this one, it would be a middle neck position. And that's the reason why these are not sold on Amazon and they're not sold directly to patients. They are only sold through licensed healthcare providers, because it is important that they're placed in the right spot. If they're not placed in the right spot, it can make things worse. So the Denneroll actually comes with a little insert inside, and it shows you how to use it, and it shows you different positions, whether you're for the lower neck, middle neck, or upper neck. Again, your doctor will tell you where to place that. If it's the lower neck, you're going to place it just above the bump here in the neck. If it's the middle neck, right about in the middle, and if it's the upper neck, upper towards the top 1 or 2 vertebrae there. On the back side of this, we see a chart where you write in how many minutes you did it for. You try to start at 3 minutes, and you put in the date. And sometimes you won't be able to do it the full amount of time. That's okay. Put what you actually did, and make sure you record that, and then you can turn this back into your doctor. Once you've completely filled it out, your doctor can consult with you, and you decide if maybe it's a good time to take a post x-ray. And usually we do see really positive changes on the post x-rays when we take a look at these after. So that's what I wanted to talk to you about today. So hope you enjoyed the video. If you have any questions, give us a call or come on in the office.